Welcome, and we're talking about breastfeeding terms. So, exclusive breastfeeding. This is giving breast milk and prescribed medication only. It includes expressed breast milk. No dummies, no teats should be given, and there should be no water given. Then a breast milk substitute. A substitute is anything that takes the place of breast milk. It may be appropriate or inappropriate substitute. So, inappropriate substitute would be something that contains all the nutrients that are required, while an inappropriate substitute would be something that just takes the place of breast milk but is not providing all the required nutrients. Then a replacement feed. This is a suitable breast milk substitute, which means it contains all the required nutrients. So, infant who is not receiving breast milk and is given a diet which contains all the nutrients. Mixed feeding. This is giving foods and solids in addition to breast milk to children below the age of 6 months. Just note that this is when it's given to children below the age of 6 months. If it's after 6 months, it's no longer mixed feeding. So the key word here is 6 months. 6 months. That's where it's important. That's what we should remember. Then complementary feeding. This is feeding babies older than 6 months with liquids and foods in addition to breast milk or breast milk substitute. So know that from 6 months onwards, breast milk alone is not sufficient, so there is need to complement the breast milk with other feeds. But the World Health Organization recommends exclusive breastfeeding up to 6 months, and then complementary feeding from 6 months going upwards. But if you introduce other feeds before 6 months, we said that is mixed feeding. Then supplementary feeding. This is provision of extra food to children and families beyond the normal ration of their home diet. Then wet nursing. This is when a woman breastfeeds and takes care of a child born by another. So even a woman that is not pregnant or that is not delivered can actually start to produce milk if their breasts are stimulated, and they can actually breastfeed a woman that is a baby that is not their own. For instance, if the mother has died, wet nursing can be done by someone else. Then dry nursing. This is when a woman takes care of a baby born by another, but in this case there is no breastfeeding. Thank you. Then supplemental suckling technique. This is when a baby sucks on the breast, but when the sucking is sucking on the breast, we also put a tube attached to the nipple, and this tube is also going to a cup, and the cup contains milk. So the milk from the cup is sucked up through the tube and taken by the infant. This is usually done in babies that have problems with sucking from the breast. So to try and stimulate sucking, first we are trying to help them to start sucking when they were previously being fed by cup. We can use supplemental sucking technique and put a tube which is going to the cup, and then put the breast there. So when the baby is sucking at first, the milk is coming from the cup, and they will be encouraged to continue sucking until they will be able to suck well from the breast.